Your Houston chiropractor, Dr. Gregory Johnson, and today we come to you with a very, very severe case of hiatal hernia and a patient who has been to over 50 medical doctors, had hiatal surgery already, and has now sought us out after researching us and watching us on YouTube, and come in for his first visit yesterday, and today's his first follow-up visit. And I'm going to show you today in great detail what we are going to do to help him with his hiatal hernia and how all this works. So, first thing we're going to do, Matthew, is have you look in the mirror. And as always, you check the posture first. Let's flex your head forward and backwards with your eyes closed. Remember what that feels like. Now see, he has limited extension right there. And then when you look in, then back to neutral. Take a deep breath in, but keep your eyes closed for just a moment. Let it out and relax and breathe normally, but keep your eyes closed. Now, from the side view here, I know you can see his head's forward and kind of pointing down some. When you do that, that actually pulls your esophagus and stomach up superior, so the stomach actually does slip through the diaphragm even easier. But looking at him from the back on the x-axis, his head is translated to the left, creating a high right shoulder, which creates a curve here and a rib misalignment with his entire thoracic spine. Now, interesting, in Matthew's case, he has had significant fight or flight issues associated with his hiatal hernia condition, and that is because the sympathetic nervous system comes out of the thoracic spine from T1, which is right here, all the way down to T12, which is right here. And interestingly enough, and also correlative, this is where the diaphragm attaches to the bottom of his rib cage. So all this being misaligned, his sympathetic nervous system being interfered with because of subluxations or misalignments in the thoracic spine vertebra, as well as the rib cage, has caused him to have what's called hypersympathetic reactivity, which is that fight or flight, that kind of that nervous, anxious feeling. It's kind of like when you scare a cat, the hair gets big on its tail and goes up on its back, and it either attacks you or flees, fight or flight. It's in all vertebrate animals, okay, including humans. So, also he has rotation. That's probably from his sleep. He's rotated to the left in the cervical, thoracic, and lumbar spine. So that's a positive theta Y. Rotation in BioPhysics terminology. Okay, and he has also a left translation of his pelvis over to the left of center. So, okay, now let's go ahead and have you lay on your back here. Now this is the first spinal decompression that I will be doing on Matthew, so you'll get to see an actual first time decompression on a patient that has severe hiatal hernia. Let's get you up this way a little bit more there, Matthew. There you go. And you get the patient on here and you make sure that you put these pins in right on the top of the pelvis. Now this is also great for treating bulged and/or herniated discs, sciatica, degenerative joint disease, osteoarthritis, degenerative disc disease. And you notice I always bring the legs up here to bring the legs up to where they're as close to parallel with the floor as possible, and that changes the angle of his entire pelvis and helps to relax the paraspinal musculature all the way from his sacrum, the pelvis here, all the way up to his cervical spine. And then we have a wet towel, bath towel here, that I wrap right around the occiput and his mandible. We want to make sure the patient has their teeth closed, and take a breath through your nose for me now, Matthew. And just let it all out and relax here. There we go. Perfect. Now, he did great on his first one, but I know he felt that all the way down, didn't you?
Oh, yeah.
Yeah. That's pretty dramatic on the first one. Got great reflexes. Post, always check the reflexes just to make sure the patient realizes that they're not paraplegic now. And we do like to have fun in here, so you'll notice we'll be kidding around a lot. But we take our work very seriously. There we go. Now, I want you to let this drop right in my hand here. That's it. I know you heard that one all the way over there. That was perfect. See how much easier it moves today than yesterday?
Oh, yeah.
That's because I decompressed you.
Felt really good.
Yeah, good. Yeah, he had a really small reaction on that one compared to a lot of first-timer decompression patients, so he did great on that. There we go, good. Now, let's have you roll sideways and have you, I'm going to take your glasses off, have you take your glasses off, and I'll put those right here. And let's have you lay on your stomach for me first.
All right. Man, my neck feels really good.
Yeah. Now, Matthew has literally been through the mill when it comes to this hiatal hernia condition and dealing with it through the traditional orthodox medical model, which is, of course, endoscopies, which are important. Those are good diagnostic tools, as well as upper, lower GIs, x-rays, MRIs, CT scans with barium, all kinds of stuff. And I'm going to let him tell you after we finish up with his treatment today about his medical treatment, his experience and the medications, and how he's reacted to all that through the years. Now I'm doing a lateral and oblique stretch here from his sacroiliac joints all the way up in through his thoracic spine into the rib cage, and sometimes you'll feel some movement in here in that rib cage. But we want to start remodeling his paraspinal musculature as well as ligaments, because ligaments hold bone to bone. Now I'm adjusting his right sacroiliac joint, and now I'm adjusting the right side of his sacrum, mostly superior to inferior, which is the y-axis, as well as the z-axis down here. And then you'll see me adjusting this one on the x-axis. And you notice I adjust the sides of his sacroiliacs differently from side to side, because when he first came in yesterday, his left leg was over an inch shorter than his right leg. And here we are today. Renee, can you get a little closer on that and take a look? See, his legs are exactly even in this position. Now when I bring them up, they stay even, and you got a little tightness right there, but not near like it was yesterday, huh, Matthew?
No, not at all.
Man, that's a great improvement. His leg was over an inch shorter on the left yesterday, and already after his very first treatment, this one being his second, his legs have evened out, and that will help us to start remodeling his entire foundation down here in the pelvis, lumbar spine, which will cause compensatory changes all the way up through his thoracic spine, all the way into the cervical spine and skull. Now, because he has a pretty significant curvature, scoliosis, right here in the lower and mid-thoracic spine regions. Boy, that was a great one too. There we go, good. And I'm going to put the head down a little bit more. Let's get up in there just a tad. There you go. Very good. Just breathe normal for me. There you go. Better. Boy, that was perfect. That one's going to set you free today. Now, he's got a lot of paraspinal hypertonicity, especially on this right side because of that scoliosis in his mid-thoracic and lower thoracic spine, with the apex of that scoliosis being around T10 to T12. Now I'm putting my elbow straight down into his paraspinal muscles. I start off lightly, and then as he inhales and exhales, especially on exhalation, I put more pressure into it. And you can see that I'm kind of bouncing off of these trigger points, and those are pretty sore, aren't they, Matthew?
Oh, yeah.
Yeah, see, you can even see my elbow. I was having a hard time even staying on this one. There we go. You can't just manipulate the spine and expect the muscles and ligaments to immediately readapt to that configuration of biomechanics. So we actually have to work on the muscles and ligaments and tissue accordingly to help that remodeling process. Now, I know a lot of you have seen this. It's one of my human meat tenderizer and myofascial release instruments for herniated. And you're going to use it in his pelvic musculature. His tensor fasciolata. Which a lot of therapists and doctors alike will call that the IT band. And you see he's got some big trigger points in his pelvic musculature. To the hamstrings from where they attach at the bottom of the ischium all the way down to the knee. You'll be able to see as I go up, even how his spine kind of involuntarily clenches and tightens up, like right through here. This treatment and the one I do with my elbow for the paraspinal trigger points is one of those hurts really good type treatments. It's very painful initially, but as you can see, we've already leveled out some of his mid and lower thoracic musculature from side to side. So we're looking for symmetry, evenness from side to side and front to back. And we're getting a lot better movement today in his entire spine because we decompressed him first. Now I'm going to let this down just a little bit more, and I'm attaching right now my thumb right at T1, bringing his head laterally, and we're adjusting the cervical thoracic region. But this actually gets movement all the way up into the occiput. See, he's got really tight trapezius muscles as well as levator scapula. These guys are really sore right there, huh? Mm-hmm. These are the levator scapula muscles. Goes from his cervical spine down to his shoulder blade, the clavicle, not the clavicle, but the scaphoid back here, and scapula, and that's what most people call their shoulder blades. Yeah, there we go. Good. Okay, now let's have you roll over on your back slowly. There you go. All right. Perfect. Let me see your hands up over your head for just a sec here. Just like leg length checks here, go ahead and stretch your fingers straight out. We do the same thing up here, and as you can see, his fingers are exactly even there. Go ahead and relax and bend. See there? That's what we're looking for. Right there, we want to be even. Now, here comes, for a hiatal hernia patient, one of the most important maneuvers, and Rance, you can come around this way just a little bit to give the viewers a better view of what I'm doing here. You don't want to get on the sternum right here, because the sternum and then the very end of the sternum is called the xiphoid process. That gets very tender. So I get underneath, see his rib cage is higher on this left side than it is right side. You can see that with my position of my thumbs here. So I'm coming down below his xiphoid process. Take a deep breath in for me now. And as the patient's letting their air out, I am putting a straight anterior to posterior, and now that's in the z-axis, and now I'm pulling the stomach down on the y-axis this way because it's slipped up into the esophagus here, and that's where it's secreting acid. Okay, again, deep breath. And let it all the way out. Now, actually, his fundus, or the top part of his stomach, has relaxed a great deal from what it was yesterday. Yesterday it was hard as a golf ball. Another one. And I usually do this in 3s. And you'll feel the stomach actually kind of pop or slip back down through the diaphragm when you first start doing it. Now today I didn't feel that because it had already been pulled down yesterday, so that was good. Now I always check the ileocecal valve over here on the right side, which is between the small intestine and the large intestine. And I usually do a little clockwise rotation and massage down in the ileocecal valve, and then on this side there's a valve between the large intestine and the rectum here that gets caught up, especially if people are eating foods that have a little husk on them like popcorn or nuts, kind of get stopped up in there. Now the sides of the thighs, what we call the tensor fasciolatum muscles, or IT bands, they're usually very tender on people that have gastrointestinal issues because these muscles here are directly connected to the L3 nerve out of the lumbar spine, mid-lumbar spine, and that's also neurologically connected to the colon. So what I'm doing here, if you notice, I'm going across the tissues. The tissue fibers run like this. I'm actually going transverse friction across them to relax them, or actually to get the myofascial hypertonicity out of there. It's very painful usually initially. There we go, very good. Now, because we're getting his sacroiliac joints and pelvis lined up, just let that knee just totally relax. There you go, good. There, good. And we're going to move over here onto the left side and do exactly the same thing. He's got good stability in his ligaments in his knee. There we go. Feel that all the way up in your low back that time? Yeah. Okay, good. Now, I'm going to have you sit up sideways here, and let's go face towards Renee there. Sit up. Now go ahead and bring your feet over and sit up. There you go. That way. Perfect. And you always advise the patients to get up sideways like that. And we are going to check his right shoulder range of motion, and he's pretty smooth there. Doesn't have a lot of grinding or crepitus in there. But we still do adjust the glenohumeral joint back into place. Now also, as I'm doing this, I'm pulling the bicipital tendon back up into the bicipital groove on the humerus. That was not as bad. And then we do the elbows and the wrist. On all hiatal hernia patients, we also advise the patients to start doing twice daily, or even sometimes 3 times daily, putting a 1/4 teaspoon of 100% natural sea salt into a little cup of hot water, mixing it up until it dissolves, swishing that around in their mouths until they swallow it, and then go ahead and swallow it, the whole cup, and that will help to decrease his internal pH into a base environment rather than being in an acid environment, which it is now. Now, you can always tell when the sympathetic nervous system is hyperactive too, because you'll feel the palms being sweaty, and a lot of times the patients get a little sweaty behind their necks too. Okay, Matthew, your first visit was with us yesterday here. Mm-hmm. Would you mind just sharing with our other fellow YouTubers what your experience has been in the medical profession, what you did to find us, and what made you make that decision?
Yeah, definitely. By the way, I feel great right now. Very relaxed. Basically, I've seen about 50 doctors all across Texas for chronic undiagnosed conditions relating to GI symptoms. I'm only 23 years old. I've already had about 4 surgeries. One of those being a hiatal hernia surgery, which brought me no relief whatsoever. I knew immediately once I was out of surgery that that wasn't the answer. And so this has been going on since I'm 19, so that's about 4 years now, almost 5. And the best part about seeing Dr. Johnson is I'm actually feeling immediate relief as soon as the treatment's over. I feel really good, and I'm really excited about this type of treatment. The way I actually found Dr. Johnson was just looking up hiatal hernias, because I got an endoscopy done 3-4 weeks ago. They had seen that my hiatal hernia was acting up again, and I wasn't ready for another surgery again. I knew balloon dilation wasn't the answer, and I just wanted to feel, you know, great again. And
naturally.
Yeah, naturally. And the best answer I've came up with among patient testimonials, online forums, is chiropractic. Chiropractic treatment. So this is only my second visit, and I'm very excited about what the next few months hold for me. And I just want to, you know, get completely better, and that's the ultimate goal here.
Great, and that's what we're here for. And I do want to let you know that there are many YouTubers that come in here for this specific treatment from all over the country. So, you know, he's lucky he lives here in Houston and doesn't have to fly in here to get this treatment. But we actually have patients that fly here into Bush Intercontinental, which is about 15 minutes from my office, and come in here. And you can find us online at Advanced Chiropractic Relief. It is Advanced Houston Chiropractor is the actual website address. And we'll be happy to evaluate you and tell you whether we think we can help you or not. And we're very happy that Matthew's getting started. We will be doing some follow-up videos with him as he makes some progress down the road and showing you that. But I think you did great for your very second visit.
There's one more thing I'd like to add. There's two things that you can't get back in this lifetime. One of those is quality of life. The second one is time. Yep. And I think that this kind of treatment increases both of those, which are invaluable.
Yep.
So
couldn't agree
just
more.
Give it a chance. If don't second question it or anything like that. If you have the financial power,
kind of jump right in with blind faith, huh?
Yeah, I mean, you can't really second guess yourself amongst anything, or else you'll never be successful in life. So
very good words.
Go ahead and give it a shot.
Very good. Well, thank you, Matthew.
Thanks,
I look forward to getting you well. Yep. Thank you. This is your Houston chiropractor, Dr. Gregory Johnson, and we'll see you next time.